A program that has Toronto police officers teaming up with mental health nurses is expanding. Changes are in the works for the Mobile Crisis Intervention Unit, and at a time where some are questioning whether police should be the ones responding to mental health calls.
The expansion is for the community and also the mental health community.
MCIT teams consisting of an officer and a mental health nurse can only respond to some of the 40,000 calls each year for a person in crisis. But the unit, a partnership between police and hospitals, is growing.
We are expanding from 10 hours of service a day to 14 and a half hours.
And there will be 12 teams on the road 7 days a week, plus a downtown team 4 times a week, where there's the most calls.
We're able to see more people and provide them with those supports.
Last year, the teams responded to 7,500 calls. With the expansion, it's expected to be more than 11,000. And they're also hoping to have a new look by July 1st, new logos for their uniforms and vehicles.
These are things that were asked of us from the community.
The expansion comes as calls to defund police have intensified. Police in the GTA have been scrutinized for their handling of mental health calls, which in some cases have ended with officers killing people in crisis.
Mental health response should not solely be a police-led type of incident. We are the only service that is available 24/7. And certainly we support non-police responses, and we will do everything we can to collaborate with other agencies.
The service shifted existing funding into this expansion. MCIT training has also doubled to 80 hours.
We're able to include things such as autism spectrum disorder, major mental health disorders, and trauma-informed care, patient advocacy. So we've really been able to enhance the course
with an emphasis on de-escalation.
We cannot never have enough de-escalation, communication skills, and also understanding the intersectionality of a racialized community and anti-Black racism, anti-Indigenous. So these are all things, implicit bias, and these are all the new things that we have injected and we have included in our training.
The police service is also launching a downtown 911 pilot project, hoping to centralize community agencies, optimistic that at times officers won't be required.
It will be a collaborative effort between our 911 call takers and the crisis worker, and to determine how these calls will be triaged and who should be attending.
More details expected on that in May. Deputy Chief Ewan also telling me that MCIT teams will be connecting the individuals they interact with to community-based services and programs instead of diverting them to hospitals, which right now are currently overwhelmed with COVID-19 patients. At Toronto Police Headquarters, I'm Faiza Amin for City News.